Healthcare in Thunder Bay matters to every single one of us, yet many voices go unheard. Welcome to Thunder Bay. Have your say, where your healthcare stories and experiences shape our community's future. Each week, we bring together residents, healthcare professionals, and community leaders for honest, open conversations about the challenges and solutions in our healthcare system. Join us as we build bridges, share perspectives, and work together to create positive change in Thunder Bay's healthcare landscape. Your voice matters, your story counts, and your community is listening.
Hello everyone, and welcome to our community podcast, Thunder Bay, Have Your Say, where we discuss real issues in the community in an effort to be a voice for those that need it most. I will be your host, Cassandra, and in today's episode, we are going to discuss the need for increased support for youth and adolescents of substance-using parents. Before we begin, we want to warn you that the topic of today's episode may be triggering for some, but it is a very important topic that needs to be discussed because it is our belief that through this podcast, we can have difficult conversations in order to drive forward the need for early interventions that exist to support community development and well-being.
In Canada, an estimated 1 in 10 children and adolescents live with a parent who has a substance use disorder, SUD. Behind closed doors, these children often face neglect, emotional trauma, and unstable home environments, forcing them to grow up far too quickly. They struggle with anxiety, depression, and fear, while trying to maintain a facade of normalcy at school and with friends. Many of these young survivors carry the weight of their parents' addiction, affecting their mental health, academic performance, and future relationships. Together, we can break this cycle by recognizing the signs and supporting these vulnerable children who need our help.
Now for a little background information. Our initiative focuses on female and males aged 14 to 25 with parents that struggle with substance misuse. This group faces significant health disparities that impact their quality of life and place them at a higher risk for developing a substance use disorder, experiencing adverse mental health outcomes, increased physical and emotional stress, and impaired academic and cognitive development. We identified our group of focus by conducting a needs assessment involving a community outreach poster, surveys, interviews, and comprehensive literature reviews. Improper allocation of funding, structural shortcomings, and stigma associated with youth and adolescents exposed to parental substance abuse has severely limited access to essential resources such as mental health support. Our chosen audience is important because their actual lived experience is what helps shape the development of interventions necessary to benefit their health and well-being. I will now turn it over to Tagveer to explain more about the rationale for our group of focus.
Thank you, Cassandra. When we started this initiative, one of the first things we had to decide was who we were really speaking to. Because as much as we were raising awareness about youth living with substance-using parents, awareness alone isn't enough. Real change depends on reaching the people who actually have the power to improve the supports available to these young people in Thunder Bay. So for this to work, we focused our political action on school administrators, community health leaders, and youth-serving organizations across Thunder Bay, including representatives from the Thunder Bay District Health Unit, Children's Center Thunder Bay, and youth-focused community programs. These groups already play a huge role in young people's daily lives. They're the ones who decide whether mental health programs get implemented in schools, whether youth can access counseling easily, and whether our idea, like anonymous QR code assessment we designed, can actually reach the kids who need it the most. And honestly, after spending time looking at the data, talking to community members, and seeing the patterns in Thunder Bay, it becomes obvious why this audience mattered so much. Thunder Bay continues to face the highest substance use rate throughout the province, and those numbers aren't abstract. They impact homes, families, and especially adolescents who are caught in a situation they didn't want to be in. These youth experience higher mental health struggles, academic disturbances, and very real risk of developing substance use issues themselves. But despite all that, they're often the last ones to be noticed. That's why we designed our work to focus specifically on these organizations that already have established relationships with youth, but they also have the structural authority to introduce programs that promote early interventions, confidentiality, and safety. Whether it's a principal agreeing to place our QR codes in their school hallways, or community health organizations supporting flexible interviews options for youth who need it. These are the people who can actually turn an idea into action. And from a broader perspective, the urgency of this issue connects directly to the principles we've grounded our work in. In our assessment, we talked about critical social theory, and the lenses become even more important as we engage with this issue. CST, otherwise known as critical social theory, reminds us to look at the power imbalances, to recognize who gets overlooked and who holds influence. In this case, youth living with substance-using parents are clearly the marginalized group, while systems built around adult treatment and crisis response hold a majority of the attention and resources. Bringing this issue forward to the community leaders isn't just about advocacy. It's about shifting a system that unintentionally leaves the adolescents behind. And this ties back to the broader public health goal of health for all. Because without targeted support, these young people continue to face long-term harm that is completely preventable with early action. So choosing this audience wasn't just a strategic play, it was necessary. We can build a real pathway for youth to access support safely, confidentially, and without stigma. We have to work with the people who can make that happen. That's why this became the heart of our political action and our community initiative. Now let's hand the mic over to Karen, who will go in depth about the theoretical and conceptual framework.
The project is guided by the critical social theory, which examines inequitable power structures, social oppression, and systemic barriers that marginalize vulnerable populations and exposes dominating populations. For the adolescents who have parents with substance use disorders, the critical social theory helps analyze how stigma, intergenerational trauma, inadequate mental health resources, and social exclusion contribute to ongoing vulnerability and mental health concerns. The critical social theory supports the project's goal of challenging inequity, promoting empowerment, and centering the voices of the silenced and overlooked youth. The project works to provide a voice to youth and provide support to the damage they have endured. Support is provided through mental health services by a community health nurse with the intention of promoting resilience, restoring safety and autonomy, and advocating for long-term systemic changes that improve mental health. The approaches used in the Community Development Initiative are designed to meet the needs of the adolescents in Thunder Bay who have parents with substance use disorders. A voluntary participatory approach is central to the project, allowing adolescents to anonymously share their lived experiences through QR code services placed strategically in schools, libraries, and community centers, with a corresponding optional interview with flexibility to meet the needs of the individual. This ensures that the assessment and intervention strategies reflect real challenges such as exposure to trauma, instability at home, academic disruption, and unmet mental health needs. The project utilizes asset-based community development by incorporating existing supports within the community, including public health nurses, youth mental health agencies, and Thunder Bay counseling. This allows for a coordinated network of resources that adolescents can be connected to in order to receive the most appropriate support and services. Capacity building is another aspect of the project, as the focus is on helping youth enhance their coping skills and develop confidence in navigating the mental health system with the support of the community health nurse. Intersectoral collaboration is another important aspect of the project, as youth affected by their parents' substance abuse often receive support from several different places, such as schools, public health nurses, and community health programs. To support them more effectively, the project encourages coordination between these services to ensure the youth are not receiving inconsistent care. Throughout the project, a trauma-informed approach is maintained, ensuring all interactions prioritize safety and empowerment by offering individuals multiple ways to engage in the interviews, whether it is virtually or in person in a safe space. The confidential aspect is explained with the exception of mandatory abuse reporting. And the approach is sensitive to high levels of trauma, fear, and stigma which are experienced by this population. This trauma-informed and collaborative approach aligns with the critical social theory by challenging systemic barriers and ensuring that youth perspectives guide the development of the project. Advocacy is central to the project, which is why the critical social theory aligns with it. We're focused on using information gathered directly from the population to highlight gaps and bring attention to their specific needs. This includes sharing findings with community health programs and youth-centered mental health supports to ensure the resources are directed toward the needs of the adolescents in Thunder Bay. Now let's hear from Cassandra about the goals and objectives.
Thank you for helping us understand more about the role of theoretical and conceptual frameworks. Our main goal and objective with this initiative is to improve access to available supports for exposed youth. By working with trusted and respected professionals within the community, we can streamline the development of support programs and ensure their direct availability to youth of substance-using parents. We also aim to foster a relationship of trust within the community by maintaining confidentiality and respect for the sensitive nature of youth exposure to parental substance misuse. Efforts will focus on both holistic and conventional methods of healing to enhance youth-centered care. To ensure longevity, we will use feedback from the community to make improvements where necessary. And finally, by collaborating with social workers, public health nurses, and school boards, support and services that teach coping mechanisms, provide access to counseling and therapy, and connect youth to community outreach programs. This will help alleviate hardships faced in order to encourage positive healing and development. Now I'd like you to hear from Kieran about important stakeholders and gatekeepers.
Individuals aged 14 to 25 in Thunder Bay who have parents with substance use disorders are the primary target group as they face significant risks related to mental health, academic disruption, neglect, stigma, and intergenerational substance use. The secondary target groups include schools, guidance counselors, teachers, community health nurses, youth mental health program staff, and child welfare services. Each of these secondary target groups are indirectly affected by the challenges the youth face, but are in position to support earlier intervention. The key stakeholders include the youth themselves, whose experiences and needs guide the project, the schools as they provide access to the target population, and observe indicators such as attendance, behavior, and academic performance. In addition, community health nurses play a central role in screening, education, and connection to appropriate care, and youth mental health agencies which provide counseling, crisis intervention, and long-term support. The gatekeepers for the project are school administrators, community center coordinators, and youth mental health program directors. This is because approval is required to post QR codes, implement interview processes, and integrate youth-friendly outreach materials and support. To ensure the inclusion of socially excluded or at-risk adolescents, the project uses anonymous QR code surveys to reduce fear of exposure, and it offers flexible interview options such as virtual, text-based, or discrete in-person meetings, and maintains trauma-enforced communication that emphasizes confidentiality and a judgment-free initiative reducing barriers to outreach. Back to you, Cassandra.
Thank you, Kieran. With the role of important stakeholders and gatekeepers better understood, I think it's important to hear about the plan for political action. Tegvir, can you tell us more about that?
Of course, Cassandra. For our political action, we deliberately focused on stakeholders who have the greatest potential to create meaningful change for adolescents aged 14 to 25 living in Thunder Bay. Based on our community assessment, these youth are often invisible in the current system. They face serious mental health challenges, educational disruptions, and barriers to accessing support, yet most existing interventions target adults with substance use rather than their children. To address these gaps effectively, our initiatives target school administrators, community health leaders, and youth-focused organizations as stated before. These stakeholders are uniquely positioned to implement programs like our anonymous QR code assessment and flexible interview options, which provide youth with safe, confidential access to mental health support. School administrators can authorize placement of QR codes in classrooms or common areas, ensuring students can engage privately. Community health leaders and youth organizations can provide counseling, follow-up, and other support tailored to the youth's specific needs. Engaging these stakeholders ensures that interventions may move on beyond awareness and into real-world action that provides safety, accessibility, and mental health outcomes. Municipal decision makers and funding bodies are another essential audience. Without their backing, scaling youth-centered interventions like school workshops, peer support programs, and outreach initiatives would not be sustainable. This support enables a long-term implementation of programs designed to address systemic gaps identified, including lack of awareness, limited access to services, and stigma surrounding parental drug use. We also intentionally include youth-serving organizations already embedded in the community. These groups bring specialized knowledge of the local context, help identify barriers youth face, and ensure interventions are culturally and developmentally appropriate. Their engagement strengthens the connection between assessment findings and actionable programming, maximizing the impact of our intervention. Finally, media representatives and public forums serve as a strategic avenue for advocacy. By highlighting the findings from our assessment and the benefits of our intervention through press releases, interviews, and community discussions, we can amplify the voices of adolescents who are often overlooked, reduce stigma, and encourage other organizations to adapt to youth-centered approaches.
In conclusion, this project highlights the complex challenges faced by youth in Thunder Bay who are impacted by parental substance use and how these experiences shape their mental health and long-term well-being. Through a comprehensive assessment of their needs, risk factors, and social determinants of health, the project emphasizes how early exposure to parental substance use can significantly affect mental health, emotional development, academic success, and long-term well-being. By engaging key stakeholders, including schools, community health nurses, mental health providers, social services, and youth-focused organizations, the initiative establishes a collaborative foundation for support. Gatekeepers such as school administrators, program directors, and community leaders play a vital role in facilitating access, reducing stigma, and creating safe pathways to care. Overall, this initiative demonstrates how collaboration and early intervention can promote resilience and better outcomes for vulnerable youth in the community. Thank you.